Hey, Jackson County, Ron Sharpe, United Way of Northwest Florida, here with another great program of Live United. Today we have a very interesting topic, so sit tight and get ready to learn a lot of great stuff. We have Miss Rita Pruette, who is going to talk to us about teen pregnancy awareness. Okay, now that's a sensitive subject, but I know that you're doing some great things with this program. Talk to us about us and tell us what you're doing.
Well, let me give you a little background about how this got started.
Absolutely.
I'm a nurse practitioner with Dr. Orlando Muniz at Mariana OB/GYN Associates. Okay. And I'm currently attending UAB and their Doctorate of Nursing Practice program. All right. And part of the program is, as a requirement for graduation, is picking a project in the area that you see
a need.
A need, yes.
Some help?
Yes.
Focus?
Right.
Gotcha.
And I'm a family nurse practitioner, but I have had the privilege of doing prenatal care most of my career. So in Dr. Muniz's office, I am helping him do prenatal care as well as several other things. And in the last few years, I've noticed a tendency of teenagers coming in kind of indicating that they may have had some intentions of becoming pregnant, or that their pregnancy has been intentional. So
on purpose?
Well, yes.
Okay, all right, keep me straight.
Okay.
All right.
So in talking with other providers in the area, such as the local health departments, they didn't seem to see that indication like I was.
Right.
So I decided to go to Chipola Healthy Start Coalition and ask them if they had any information in this area. And what I found from gleaning their information was a little disturbing.
Okay.
And
so what are you seeing? You seeing some spikes? You seeing some increases?
Well, I'd like to share a few slides
Sure.
That I obtained from Chipola Healthy Start Coalition,
okay.
and
right.
it might help to explain a little bit better what we found.
Okay. All right. All right. And they are going to. There you go. There's a slide right there.
Right. Those are the local teen births, the actual numbers. Now, Chipola Healthy Start covers the 5-county area of Liberty, Calhoun, Jackson, Washington, and Holmes County. So starting in 1999, you see there were actually 225 teen pregnancies in this 5-county area.
Right.
And you can see there is a decrease that bottomed out at 2002. But then we see a steady increase, and the last numbers that we have on the community assessment that Chipola Healthy Start did was 2008, with a number of 230 actual teen births during that period of time.
In all those whole counties, those 5 counties?
Yes, those are the 5 counties.
All
now, what we have found nationally in 2011, we are seeing a record low in teen pregnancies. Right.
A low nationally.
A low. It is a record low nationally.
At 2011.
Yes.
Okay.
Yes.
All right. Do we have any local? Do we have any current more data than?
We don't have any current data as of yet.
Okay. All right.
Yes. And another study that was done several years ago looked at the intention of teen pregnancy, and it determined, now this was a nationwide study,
right,
that 3/4 of the teen pregnancies are unplanned.
Or unplanned?
Okay? Unplanned,
3/4?
3/4.
Okay.
Which leaves 1/4 of teen pregnancies
on
being
purpose.
planned.
Gotcha.
Right.
Okay.
So if you'll keep that in mind.
I've got you.
Okay.
All right.
The next slide shows actual numbers broken down per county.
Okay. Because I'm going to look at this. Okay, that's that one. All right.
Yes.
Okay.
Now these are broken down, and it's hard to see the different colors. Our 18 to 19-year-olds, you can see the dotted line is running around 80. That is Florida's teen pregnancy rate. okay, of
Okay.
around 80. Now
Right.
remember we said nationwide, it's about 34.
Okay.
Okay. You can see the 5 counties in our Chipola Healthy Start Coalition are significantly above not only the national, but also the state average.
Right, right.
Yes. Now our 10 to 17-year-olds, which is on the bottom, okay?
That's the ages?
Yes, those are the
10?
ages. Yes.
That's scary.
10 to 17, yes. The dark dotted line, of course, then again, is the Florida average, but we are either at or above the state average for our 10 to 17-year-olds.
Wow, okay. Let me ask you, is that we're going by, I'll call it ages. Is there any other data, i.e., is it Caucasian? Is it African American? What do you? Is there the other data? Do you see a spike or a lower? Is it pretty much averaged out? So it's races. I mean, is there any other data collected?
Yes, there is some other data collected, and I don't have any slides,
No, you're fine.
To discuss that. There is a slight increase in the African American population as compared to the local population, but it's not a huge difference, right?
What about current? In other words, I guess what I'm just curious is that, because you and I both know the family, the nucleus, the husband and the wife. Do you see? Do you have data that tells us with single parents that the pregnancy is teenage pregnancy is also?
And I'm sure they do.
Spiked.
Let's talk about the next slide.
Gotcha.
Okay, and that might help
me out.
Yes.
Okay.
Yes. Now on the Healthy Start prenatal screen, there are several questions that are asked, but there were 2 questions in particular that this slide covers. The first question was, thinking back before you became pregnant, did you want to be pregnant now, pregnant later, or not pregnant? Now, this slide represents unmarried teens in their response to that question in the blue. So our 15 to 17-year-olds indicated that before they were pregnant, they wanted to be pregnant now, and that is at 78.1%. Now, our 18 to 19-year-olds indicated that they wanted to be pregnant now at 84.1%.
8% more?
Right. But remember, we talked about that 3/4 of teen pregnancies are unintended.
Exactly.
This is a converse, right. Right.
Flip.
Now, the second question was, is this a good time for you to be pregnant? Yes or no? So our 15 to 17-year-olds said at 64%, yes, this is a good time for me to be pregnant. Where our 18 to 19-year-olds at 70.5% said, yes, this is a good time for me to be pregnant. And this is our unmarried teenagers.
Almost 15% either way on the 18 to 19 or the 15 to 17 between a percentage wanting to be pregnant versus it's a good time to be. In other words, what I'm saying is that both of them calculate at about 15% difference. In other words, 84 versus 71, let's just say 78 versus 64, 14, 15. So it's running pretty consistent, if you will, even though there's an increase.
Right.
But there's that magic 14% roughly.
Right.
Between them.
Yeah. So what we're looking at is our 15 to 17-year-olds at 64% are saying, now is a good time to be pregnant, and before I got pregnant, I wanted to be pregnant now. Where our 18 to 19-year-olds at 70% are saying, this is a good time for me to be pregnant, and before I was pregnant, I wanted to be pregnant now.
Okay.
So in taking that information, I am trying to look look at then what can we do, number one, to kind of change this mindset. And then a part of my research then with UAB is sitting down with some of these girls who indicated this, and asking them questions in a focus group, trying to understand their motivation on why they wanted to be pregnant now, and that now is a good time for them to be pregnant. Trying to understand,
get a better understanding of it.
Sure.
We've got some numbers now. Let's try to dig deeper.
Absolutely. Part of the problem as a provider is that the research out there, the literature, does not cover intentional teenage pregnancies, because we remember they're not wanting to be pregnant, okay, according to the research. So when I have a teenager coming in indicating to me that they're thinking about being pregnant, I don't have any evidence-based interventions or practices that I can use to help them not to become pregnant. In other words, what I do right now is based on the assumption they don't want to be pregnant, and it's not working.
Exactly.
Right, right.
Let me ask you. I don't know. I'm brainstorming now.
Sure.
We got a lot of shows going on TV, and I say we have a lot of shows. Maybe just one. It just seems, well, to me, maybe one's too many. I mean, I have 3 boys, you know, and I don't even know what channel, but it's Teen Mom and and what have you.
16 and pregnant, I believe is another
you know.
one.
So, what are your thoughts? Is it? And I'm asking, and I'm sorry, not. Do you think they're helpful?
Well, I've never actually seen one of those programs. But my thinking is, you know, these programs are seen nationwide.
Exactly.
Okay. And nationwide, we're seeing a downtrend.
True.
Okay. So I don't think they have an impact on our teens wanting to be pregnant. You know, if it were true, you would think you would see an increase nationwide, right, instead of a decrease.
Yeah, and I guess the thing is that, you know, it's kind of like one of those things when you start talking about teen pregnancy. I mean, you don't want to talk about it, but you need to talk about it.
Oh, absolutely.
You know, it's one of those and if you stick your head in the sand, you are in trouble.
Absolutely. And what I have done is I have created a PowerPoint presentation that is a community awareness program. And I have 2 goals in this presentation. I'm wanting to get the word out that we have a teen pregnancy problem in this area, and I'm wanting to get people then to start talking about this problem. And I'm kind of looking at this as a community problem. So we're going to need community
support.
Sure. And community answers to help.
How to solve them.
Absolutely.
We got to raise the bar and the awareness.
Right.
And how do we fix it?
Right. And so I'm targeting several different areas as far as where I'm wanting to bring these programs. I really feel our faith-based organizations need to be a part of the solution.
I agree.
And come to the table and help us with this problem.
Let me ask you a question.
Yes.
Okay. Have you had any forums? Have you had where you've had a chance to have a community invite?
Oh, sure. I am available to go into churches.
Okay.
Yes, and I have contacted several churches, but I am willing to go wherever
Absolutely. You can go to share the story.
Another area that I'm focusing is civic organizations, and I have
Rotary, Kiwanis.
Absolutely.
The Pilot Club.
I've been to several, and I am scheduled to go to several to discuss it. And I'm talking about the 5 county areas too that we're looking at. I also want to bring this presentation to educators because I feel too our school system needs to be a part as well.
Absolutely.
Parent organizations, and I'm also trying to outreach to healthcare providers because they too aren't aware that we're seeing this trend among our teenagers. And Chipola Healthy Start has been a great partner in helping me create this program and giving me equipment then to be able to share this program to the different groups.
Rita, one thing that I am so very, very proud of is our agencies. under the United Way umbrella, and many others, is that we really do work well together.
Oh,
When
absolutely.
there's a need or a cause or awareness, they join together and help out in any way. So it's a blessing.
Right. Not only has Chipola Healthy Start given me then the data and the equipment and all, their input into this project that I'm doing has been tremendous, and I couldn't do it without them.
Well, you know, and my mind's running right now, but I'm sitting there thinking as that the next time that the health department or the hospital in all counties is when they have a I won't say job fair, but it's not a health fair.
Right. Right.
Then we need to make sure that we're getting you there.
Okay.
Do you have any literature? I know you got your PowerPoint. You got a lot of great data.
Right.
Of course, then you start getting literature. Then you got more costs, expenses, and so forth.
Right. Right.
But
well, let me tell you a little bit about what has happened since I've started the presentations.
Gotcha.
I've had several individuals and organizations that have said, "How can I help?" I've had one person volunteer to create a video that may be placed on YouTube or the internet.
Boy, that
I've also had someone else volunteer to create a website. And so, and then several
Facebook.
individuals, yes, several individuals who have volunteered to do whatever I need them to. So, and this all has been as of July 1. That's when I started my first presentation. Yes. So it's been a little overwhelming because I'm still working full time, still going to school almost full time.
I understand.
And so my next step is I'm going to create a task force.
Okay.
Trying to organize then everyone who has come and said, I want to be a part of the solution.
Solution,
right.
Exactly.
And we're hoping within the next 4 to 6 weeks coming together and start planning as a group so we can get organized and go in a positive direction and trying to impact the teen pregnancy issue that we see here. And I'm going to call it CAP, C-A-P-P, and that's Chipola Adolescent Pregnancy Prevention.
Oh, I love it. Good deal.
So I have created an email called captaskforce@yahoo.com. So if anyone is interested in more information, want to volunteer, or would like for me to come and speak to their organization, I can be contacted at that.
What is the best way to reach you, Rita?
Well, if they'll contact me at captaskforce@yahoo.com, and that's C-A-P-P taskforce @yahoo.com.
All right. And you may not, because you may be overwhelmed, which could be a good thing or a bad thing. Is there a number that you want to share? Maybe?
Yes. Let me give them my work number.
Okay.
Okay. And this is Mariana OBGYN Associates.
Okay.
And when they leave a message, if they'll just let them know, yes, it's for Rita Pruette.
Okay.
And our number is 850-482-6484.
Good deal.
And
well, I hope I'm not over, because when I asked you that question, all I know is this. I've had the wonderful opportunity to talk to you several times.
Yes.
Coming before today's date, we'll get a chance to get together and talk. But I know that you're passionate. And very
absolutely.
Driven. And God love you. I mean, I'm serious about what this mission that you're on and raising the bar. So I just want to make sure that in every avenue that we can get someone and an outreach to be able to reach you, that we do so.
Sure. I've been a nurse practitioner working in Jackson County since 1991.
Okay.
Prior to coming to Jackson County, I was a nurse practitioner in Gadsden County, and I worked at the Shanks School-Based Clinic, which is the first school-based clinic in the state of Florida that was established in the late 80s. And it was out of that experience that not only did I get a lot of prenatal experience with teenagers, but then I learned to have a passion about adolescent health care because these kids, they're making decisions that's going to impact them the rest of their life. Right.
Absolutely.
Right. And even if we can make just one adolescent think twice about totally changing their lives, but making it for a positive direction, then it will be all worth it.
You know, you and I are talking, and I'm smiling because I'm thinking about my 3 boys, 23, fixing to be 21, and 15 going on 32. And it's because they do know everything. And you know,
sure.
And the
Absolutely.
thing is that we were sitting here talking, and you've heard the economic numbers.
Sure.
That if they drop out of school,
right,
the economic impact that it has.
Sure.
GED, what have you. In other words, it just continues to snowball.
Right.
Their potential of earnings and everything else.
Sure.
You know, and they think that they do know. And it's just like I tell my kids, guys, do me a favor. Learn from my mistakes. You don't have to go out. I mean, you know, that's anyway.
Right. One of the goals of the Chipola Healthy Start Coalition is to reduce infant mortality. And we know that teenage moms have a higher incidence of infant mortality.
True.
So if we can impact our teenage pregnancy rate, then we should continue then to see an impact, a decline in our infant mortality rate as a whole. We do know too that teenage moms tend to drop out at a higher rate of high school than their counterparts who are not pregnant. Also too, then because they start their families early, they do have a lower socioeconomic status than the counterparts who have not, as teenagers, chosen to become pregnant. So yes, it can, as a whole, have a big impact not only on that child that they're bringing into the world, but the family and then the community.
I mean, it does.
Absolutely.
We all have to pitch in.
Absolutely.
And we just got to continue to educate
yes.
for all the right reasons.
Yes.
Well, wonderful program that you're working on. Just thank you for bringing this to the awareness. Is there any other information that we have not had a chance to touch base on that we may have missed, overlooked, that say, oh, wait a minute, something else, is there, can you think of anything else that we?
I think we've covered it pretty well, yes.
Okay.
And because this is so new, and I'm still trying to.
Fact-finding.
Right, fact-finding and trying to juggle many things.
I know.
And that's one reason why I'm going to create the task force, because I do need help.
Sure.
In able to be able to take this to the next level.
Well, Rita, I know you know that we do have wonderful media partners, i.e. press releases, communications. If you go by and see Sid Riley and any other of the papers and just say, hey, listen, maybe one Friday afternoon, I'm brainstorming, so just use this as only as a guide and say, you know what, wonder if we could kind of have a coalition meeting where we kind of come together and we just say, you know, maybe it's Friday afternoon at 2 o'clock, we'll meet at the library, or another site, and try to bring the resources together and kind of then disperse about how you want to guide us, if you will, where you want us to take it to the next level, where the needs are.
Well, I have you on my list to contact when we start the task force as far as...
Let us know how we can help you.
Absolutely.
Because, you know, here's the thing, and I don't want to hammer it, but it is true. Everything from the teenage pregnancy, it impacts us all. It really does. And, man, there's just... Right now, funds are tight, budgets are cut. We're trying to continue to teach financial literacy, better decision making, whether it's finance, whether it's healthy lifestyles, obesity, you name it.
Right.
So this is just another community issue that we need to bring to light and say, okay, guys, you know, we can do something about this.
Absolutely.
And it's one child at a time, one person at a time, and then continuing to bring the community business partners, our hospitals, our health departments, our churches, our schools, what you had mentioned earlier, our doctor's office, because it's something that we need to address. And you said you started in the 1st of July?
Yes, that was when I started with my first presentation. And each time I give the presentation, I get really good feedback, and people who are wanting to help. So
That's super.
yeah,
That's
yeah.
good. That's good. Well, just keep us posted. Let us know what we can do to help you. I'm a firm
I
believer.
will.
It's like I tell you, what, I'm only as good as the people around me. And this is something that we need to work. And thank you for doing what you're doing.
Thank
Much
you.
success to you.
Thank you, Ron. Thank you for having me.
Oh, you're welcome.
And I will keep you posted.
Good deal. Well, Jackson County, just another example of what United Way of Northwest Florida is trying to do, and that is just continue to teach and share awareness of the needs in this community, and also the wonderful people and our agencies that are impacting the lives here in Jackson County. Thank you for allowing me this opportunity. Thank you again, Ron Sharpe, United Way of Northwest Florida, with Live United. Thank you.